How to prevent the flu. Since there is no flu cure, you should aim to avoid the flu altogether. You may be surprised to learn that preventing the flu involves more than the flu vaccine and good hygiene. Installation of SANITAIRE Germicidal Ultraviolet air disinfection can also decrease the chance of getting the flu or spreading flu germs to others. The following 4 flu prevention steps can help protect your employees, customers, students, and patients. We will look at each in detail. Getting the flu vaccine, taking everyday preventative actions, taking flu antiviral drugs if prescribed, and installing SANITAIRE UVC room air sanitizers. Step 1. Get the flu vaccine. According to the CDC, a yearly flu vaccine is the first and most important step in protecting against influenza and its potentially serious complications. Flu vaccination can reduce the number of illnesses, doctor's visits, and missed work or school due to flu, prevent flu-related hospitalizations and deaths, and possibly reduce the severity of illness if someone gets the flu after vaccination. The CDC recommends that everyone 6 months of age and older get a flu vaccine every year by the end of October. Vaccination of the following high-risk people is especially important to decrease risk of severe flu illness: people 65 years and older, young children, pregnant women, and people with chronic health conditions such as asthma, diabetes, or heart and lung disease. Vaccination is also important for healthcare workers, people who live with or care for high-risk people, and people who live with or care for infants. Step 2. Take everyday preventative actions. In addition to getting a flu vaccine, take the following actions to decrease the likelihood of flu illness. Avoid close contact with sick people. Cover your nose and mouth when you cough or sneeze. Don't touch your eyes, nose, and mouth. Wash your hands often with soap and water or alcohol-based hand rub. And disinfect surfaces and objects that may be contaminated. If sick with flu, the CDC recommends that you stay home for 24 hours after your fever is gone, except to get medical care or other necessities. Please note, your fever should be gone without using a fever-reducing medicine. Step 3. Take antiviral drugs if prescribed. If you get sick with flu, prescription antiviral drugs can make your illness milder, shorten its lifespan, and prevent serious flu complications. The CDC recommends prompt antiviral treatment for people who are severely ill or at high risk for serious flu complications. For people with high risk factors, treatment with an antiviral drug can mean the difference between having a milder illness versus a very serious illness and possible hospital stay. Studies show that flu antiviral drugs work best for treatment when started within 48 hours of getting sick. Starting them later can still be helpful, especially if the sick person has a high-risk health condition or is very sick from the flu. Follow your doctor's instructions for taking these drugs. Flu-like symptoms include fever, runny nose, chills, body aches, headaches, fatigue, cough, and sore throat. Some people, especially children, may have vomiting and diarrhea. People may also be infected with the flu and have respiratory symptoms without a fever. Step 4. Install SANITAIRE Germicidal Ultraviolet Room Air Sanitizers. SANITAIRE Germicidal UV Room Air Sanitizers help protect occupants from infection due to flu, effectively destroying airborne bacteria, mold, and virus in enclosed occupied spaces, such as classrooms, offices, manufacturing, shelters, auditoriums, and any other occupied areas, particularly those that are crowded, poorly ventilated, or have a high risk of cross-infection. SANITAIRE Germicidal UV Room Air Sanitizers utilize sterile ray UVC lamps, which are completely enclosed within a reflective exposure chamber. Various models adapt to any setting. Shop at buyultraviolet.com. To summarize, the 4 flu prevention steps are: getting the flu vaccine, taking everyday preventative actions, taking flu antiviral drugs if prescribed, and installing a SANITAIRE Germicidal UV Room Air Sanitizer. Want to learn more about how germicidal UV disinfection can help with flu prevention? Call our UV application specialists at 631-273-0500 or send an email to sales@atlanticuv.com.